Welcome to the History, Law, and Justice Podcast. I'm your host, Michael Buckner, a lawyer and amateur historian. I will explore with you legal issues affecting governance, society, and culture of the United States and other civilizations, both past and present, using history as my guide. The global impact of the COVID-19 pandemic, including the public health roles of the federal, state, and local governments in this crisis, led me to ponder how did the levels of government in the United States respond to the first epidemic in the nation's history. To tell that story, we need to go back to the year 1793 for the yellow fever epidemic that affected Philadelphia, Pennsylvania, which at 50,000 inhabitants was then the largest city of the United States and, until the completion of the new city of Washington, was the nation's capital. The summer of 1793 was dry and hot. In addition, the water levels of bodies of water throughout the city, like streams and wells, were severely reduced, and that became breeding grounds for mosquitoes. During this period, political refugees from the Caribbean escaped to the city. Those refugees brought with them yellow fever. The now plentiful mosquitoes spread the disease by biting an infected person and then biting a healthy person. The first yellow fever deaths occurred in July of 1793, and the mortality rate grew steadily thereafter. By the end of September, 20,000 people had fled the city to escape the disease. The mortality rate peaked in October of 1793 when cold weather killed off the mosquitoes and ended the epidemic in November. According to the most available stats, between August 1st and November 9th, 1793, approximately 11,000 people contracted yellow fever in Philadelphia. Of that number, approximately 5,000 people, or 10% of the city's population, died. The epidemic was the first major public health test for this young nation. So how did each level of government respond to this public health concern? Well, first, let's start with the federal government. In short, the U.S. government continued basic federal operations, but did not have a direct or indirect role in combating the epidemic. Let's look exactly what the federal government did or did not do. Well, under the 10th Amendment to the Constitution, and with no court precedent or any congressional imposed authority to provide guidance, the federal government had no apparent power to directly involve itself in the matter. To make matters worse, Congress was not in session, so the legislative body could not grant the executive branch with any new authority, even if there was sentiment for the federal government to act. The first president of the United States, George Washington, and his cabinet met in Philadelphia until September 10th, when the president departed the city for official duties outside the city and a scheduled vacation. The post office and the Treasury Department continued to operate during the epidemic. And the only direct yellow fever action the federal government appeared to take involved the War Department, which monitored the epidemic so that President Washington and the cabinet could decide when it was safe for the government to return to Philadelphia. What about the government of Pennsylvania? Well, similar to the federal posture, history does not indicate a direct role for the state government in addressing the spread of yellow fever. For instance, the governor of the state at the time, Thomas Mifflin, became sick and was advised to leave Philadelphia on the advice of his physician. The state legislature concluded its session early than planned due to conditions from the epidemic. That's it. Okay, if the federal and state authorities did nothing, well, which government entity filled the public health void? Well, under the structure of governance in the 1790s in the United States, it was the city of Philadelphia that possessed the sole authority on how to deal with the outbreak. Here's a brief summary of what the city did. Although the members of the city council fled the city, the mayor at the time, Matthew Clarkson, stayed and prepared the city's response. What he did by the second week of September, he set up roadblocks, organized patrols, implemented inspections, and ordered quarantines. In mid-September, the mayor and citizens, including the city's Black Americans, formed various committees which managed the hospital treating the sick, cared for the sick in various ways, including transporting the sick to hospitals, carried the dead to the cemetery for burial, and provided other assistance for those who could not help themselves. The city also observed that patients in the hospital needed detailed medical care. So what the city did was retain a French doctor who had extensive experience dealing with the yellow fever in Haiti, and brought that doctor here. Now, despite this new resource, the mortality rate at the hospital was approximately 50%. But still, the city did everything it could during this crisis to address the yellow fever epidemic. The yellow fever epidemic of 1793 severely taxed Philadelphia's political and public health systems. That crisis showed that the new nation was not prepared to deal with an epidemic, including it lacked the infrastructure to aid the sick and dying. In response, the state created the Philadelphia Board of Health, and it was that board in 1795 started being responsible for enforcing quarantine and sanitary rules. Overall, important lessons were learned from this experience, some of which we are applying today. You have just listened to the History, Law, and Justice podcast with your host, Michael Buckner. Thank you for your attention. If you have any questions or feedback on this episode, Michael's contact information is included in the description box. Citations to sources used to prepare this episode are also listed in the description box. Finally, don't forget to click on the link to subscribe to receive the next episode of this podcast. Remember to let history serve as your roadmap for future success.